All right, this is Big Picture Anatomy with a look at connective tissues overview. First, let's take a look at just the general features of connective tissues. Remember, these are all always characterized by having cells that are in a matrix, dispersed throughout the matrix, as opposed to, let's say, an epithelial tissue where the cells are all stuck together in a thin sheet. We find two types of cells in general in connective tissues. We find fibroblasts, which are the cells, whenever you see that blast, these are cells that make something, and in this case, of course, they make fibers, as the name would suggest. These are elongated cells that we'll find along the fibers in the matrix. And then we have immune cells, which are the equivalent of white blood cells. We can have a variety of different types of immune cells. They tend to be rounded in shape and smaller, interspersed throughout the matrix. When we look at the matrix itself, what it's made up of is going to be the thicker collagen fibers. Remember, collagen is an elongate structural protein that the fibroblasts make and then extrude out of the cell. So we see these thick collagen fibers giving structure to the matrix. We tend to see the much thinner, what we call reticular fibers. These form a network throughout the matrix that the cells tend to use to orient and align themselves along. So they're also made out of collagen, what we call them thin reticular fibers, and they're much thinner. We occasionally see another type of curlicue or coiled type of fiber called elastic fibers. They're made from a different protein called elastin, and some connective tissues, elastic connective tissues, have many more elastic fibers. In fact, they might be made out of almost entirely elastic fibers. So that's the fiber component of the matrix. We would also find in the matrix what we call ground substance, which is a very watery or gelatinous-like background material that fills everything in. It tends to be formed from a sugar-protein combo that just, like gelatin or jello, gives it that gelatinous consistency. The appearance here of having all of these components, these fibrous components interspersed through a gelatinous matrix, is an example of what we would call a kind of generic or areolar connective tissue that might fill around blood vessels and nerves underneath the surface of your skin, and generally spaces like that throughout the body. So just a quick summary. Remember, connective tissues are cells that are interspersed throughout a matrix. The cells are fibroblasts, which are elongate cells that make the fibers, and immune cells, which are rounded white blood cells interspersed throughout the matrix. The matrix is made up of the thick collagen fibers that give it structure, the thinner reticular fibers that form a network for the cells to orient on, and sometimes the presence of elastic fibers that give it stretchiness or elasticity. Now let's take a look at the classes of connective tissues. We can divide these into two different, and these are now more specialized kind of connective tissues. We can divide these into two groups: loose connective tissues and dense connective tissues. Within the loose connective tissues, there's two main types: reticular connective tissues, named after the reticular fiber network that dominates the connective tissue, these very thin reticular fibers that form a network. They're made out of collagen, but they're much thinner than the thick structural collagen fibers. And these tissues tend to be full of immune cells, interspersed or located, distributed along that reticular fiber network. We find this kind of connective tissue in lymph nodes, bone marrow, and other blood-forming tissues like that. Adipose tissue or fat tissue is also a loose connective tissue made up, again, of a reticular fiber network through which the much larger fat cells with their large fat storage component are distributed throughout the network. And of course, this forms adipose tissues or fat tissues throughout the body. The dense connective tissues are characterized by a much denser network of thick collagen, structural collagen fibers. And again, we have two types. We have the regular dense connective tissues where the collagen fibers are all lined up along the length of the tissue, and we see lots of fibroblasts distributed throughout the tissue. We would tend to find this in places like tendons and ligaments. Irregular dense connective tissues are where we find the collagen fibers running in many different directions. Not one predominant direction. We would also see lots of fibroblasts dispersed throughout the tissue, and this would tend to be found in locations like the dermis of the skin. So just a quick summary of the classes of connective tissues. We have loose connective tissues, principally reticular connective tissues with lots of immune cells dispersed, or white blood cells dispersed on a thin reticular fiber network, and adipose tissue, with much larger fat cells, again dispersed on a reticular fiber network. And then we have dense connective tissues characterized by thick structural collagen fibers, regular dense connective tissues where the collagen fibers are lined up in one particular direction, as we would find in tendons and ligaments, and irregular dense connective tissues where the fibers run in many different directions, as we might find, let's say, in the dermis or the leathery part of the skin. That's an overview of connective tissues from Big Picture Anatomy.